Hello everyone, let's take a moment to talk about how far lab testing have come. Gone are these days where you had to wait days for results. Today, we are stepping into an era of rapid diagnostics that is quick, accurate, and sometimes right at the patient's bedside. It is known as point of care testing. Point of care testing, or otherwise known as POCT, is changing how we approach infectious disease. These are small portable devices that can detect infections in real time. You can think of glucose meters, rapid malaria tests, and antigen tests for COVID-19. They are easy to use, require minimal test training, and most importantly, give fast results, often within minutes. This makes a huge difference in rural or under-resourced settings where traditional labs may not be available. Imagine being able to test for HIV or influenza right in a community clinic and starting treatment immediately. That's the power of point of care testing.
Techniques for rapid diagnosis. So these molecular techniques are revolutionizing infectious disease detection, enabling rapid, accurate, and scalable pathogen identification. So key technologies include the polymerase chain reaction, which are gold standard for COVID-19 and HIV viral loads monitoring, and they lead to reduced detection time from days to hours while maintaining high sensitivity. We also have the isothermal amplification, so the use of LAMP, loop as mediated isothermal amplification, which are deployed in field settings for Ebola and Zika virus screening. Then it enables points of care testing in resource-limited environments without lab infrastructure. We have the next generation sequencing, which are critical for identifying SARS-CoV-2 and tracking of methicillin-resistant Staphylococcus aureus outbreaks in hospitals. So they provide whole genome data for outbreak surveillance and antimicrobial resistance profiling. We also have the CRISPR-based diagnostics using Sherlock and Detect-R, which are used in paper-based detection of dengue and high-risk human papillomavirus strains. And then it eliminates the need for specialized equipment, enabling low-cost screening. However, they have limitations, challenges, such as cost and accessibility barriers for low-resource settings, accuracy challenges leading to false positive or negative results due to its high sensitivity. We have infrastructure demands such as cold storage and also bioinformatics expertise, and also have throughput trade-offs, that is between speed and scalability. Ethical concerns include privacy risks with genomic data collection, global inequity in diagnostics access, disparities. You have potential overdiagnosis leading to unnecessary treatments, social stigma, and potential misuse of results. And we have regulatory gaps for emerging point of care testing. So these limitations need to also be accurately looked into in order to lead to responsible implementation of these diagnostics tools.
We saw this play out during the COVID-19 pandemic. Rapid antigen tests help screen people quickly at airports, at schools, and even homes. It wasn't perfect, but it helped control spread. Another great example is tuberculosis. Newer tools like the GeneXpert can detect Mycobacterium tuberculosis and resistance to rifampicin in under 2 hours. That's a game changer compared to the traditional 2 to 8 weeks culture method. These tools are saving lives every day by making diagnosis faster and treatments even more immediate. Rapid diagnostics is not just a cool innovation. They are the future of accessible, responsive, and effective healthcare, bringing closer the lab to the patient, especially where it's needed the most. As science advances, we are only getting better at this day by day.